Hello, my name is Trish McDermott. I'm the Senior Communications Officer here at Berkeley Unified. I also oversee our COVID operations. This webinar should help families understand the key COVID-19 risk mitigation protocols in place at all of our schools for the 22-23 school year. We want to thank everyone in the Berkeley Unified community for their strong adherence to our safety protocols. It is this work that we do together that keeps everyone in our school community safe. All of our protocols for COVID-19 align with guidance coming out of the California Department of Public Health for K-12 schools. We also work very closely and will continue to do so with our public health partners at the City of Berkeley. We are Berkeley Ready to open our schools safely on August 15th. We've been running vaccination clinics at our schools in partnership with the City of Berkeley and Carbon Health, and we really want to encourage everyone in our school community to get vaccinated, students, families, and staff. And please note that children as young as 6 months old are now eligible to be vaccinated. And whether it's hand washing or testing or masking or air purification systems running in each and every classroom, we are ready for a safe start to the 2022-23 school year. This webinar will look at 5 key safety protocols that may impact families this year. This includes masking, testing before returning to school, what to do if your student has symptoms, what happens if your student is a close contact, and what to do if your student tests positive for COVID-19. When we begin school on August 15th, indoor masking will be strongly recommended at all BUSD schools and facilities. And families can be reminded that if their student is a close contact, they should mask for 10 days after the exposure. Likewise, if their student tests positive for COVID-19, their student should mask for 10 days after symptoms began or they tested positive. This year, and in alignment with public health guidance, we are strongly encouraging families to have their students test prior to the start of the school year. You should have heard from your principal about how you can pick up at-home tests for your student. Ideally, we'd like to see you test your student on August 12th, and if your student tests negative, to test again on August 14th. We'd also like you to upload test results, whether negative or positive, to the primary health platform, and we'll explain about how to do that in a subsequent slide. If your student does test positive on the 12th or the 14th, please keep them home from school on the 15th. Email covidcase@berkeley.net and provide the following information: your student's first and last name, the school they attend, the date symptoms started if they had symptoms, and the date they tested positive. You'll receive an isolation notification with information about how your student can return to school. On the right-hand side of this slide are the COVID-19 symptoms from the CDC: fevers or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. If your student has even one of these symptoms, please keep them home from school. There are 2 pathways to return to school after experiencing a COVID symptom. The first is to test negative and be feeling better. Essentially, that means your symptoms are gone or improving, or your student's symptoms. And they shouldn't have had a fever in the last 24 hours without having to use fever-reducing medication. Alternatively, you can get a note from your doctor explaining that your student does not have COVID-19. It's important to remember, too, that if your student takes a negative test or receives a negative antigen test on either day 1 or day 2 of experiencing symptoms, you can consider keeping your student home for another day or even 2 days and test them again. And this might be especially important to do if your student both has symptoms and is a close contact. Just to be clear, this is not a public health requirement, but it is a consideration offered up by public health. A close contact is someone who spends more than a cumulative 15 minutes in a 24-hour period in a shared indoor airspace with someone with COVID-19 while the person is infectious. At BUSD, a shared indoor airspace could be a classroom, but it also could be the school bus or the gymnasium or the library. This year, there are no quarantines after a student is exposed to a case. It doesn't matter if the student was masked or unmasked during the exposure, or if they are vaccinated or aren't vaccinated. Every student who is a close contact to a case can remain in school unless they have symptoms. If your student is a close contact, you'll want to test between day 3 and 5 of the exposure and have your student wear a well-fitting mask for 10 days. Public health has changed contact tracing a bit this year. Essentially, it correlates with disease level in your school community. So for example, when we're at a low disease level, families will receive a direct notification if their student is a close contact with a case. That notification will include information about having your student test between day 3 and 5 of the exposure, and it will ask you to watch for symptoms and not send your student to school if they begin to develop symptoms. During an outbreak, which is 3 or more epidemiologically linked cases in a 14-day period at a school site, and low disease rates, your family would receive a direct notification relative to the exposure and that the exposure was part of an outbreak. Again, they'd be asked to do the same thing, which is test their student between day 3 and day 5 and to be vigilant for symptoms. When we move to high disease rates, which are we are very likely to see this school year, families will receive a once weekly all school notification. That notification will indicate that we have reached a high disease rate in our school district, that there's a strong likelihood that their student could be a close contact, and urging families to have their students test between day 3 and day 5, and then also to be vigilant about symptoms. So you can see that depending on what disease rates are looking like in our school community, you might receive 2 different types of notifications of a close contact. And that's fine, it aligns with public health guidance. Let's talk for a minute about what happens if your student tests positive for COVID-19. The most important first step is to keep your student home. If you look at the graph on the right, you might better understand what we call these different milestone days after someone tests positive. Day 5, day 6, day 10. Let's take a minute to explain this. Day 0 is the day your student first developed symptoms. If your student never had symptoms, then day 0 is the day they actually test positive for COVID. Now, a pathway to return to school would be to have your student take a test on day 5, and if they tested negative and also met some other criteria, which include improving symptoms and no fever in the last 24 hours without using fever-reducing medication, they would be eligible to return to school on day 6. You'll need to send the school a copy of their negative test result. And when you get that notification about isolation, when you first tell us your student is positive, there's some directions about how to notify the school of the negative test result. Now, it's very possible that your student could test positive again on day 5, or you may elect not to even test your student because they're still experiencing significant symptoms. In that scenario, we'll need you to call the school on day 6 to let them know that your student is absent, just like you would for any other illness. And here's why. When we are told that your student is positive for COVID-19, we go into Infinite Campus, that's our student information system, and we flag them with a COVID flag through day 5. That lets the teacher and administrators at the school site know that your student is home on isolation. But after day 5, there is no flag because some students will actually be returning on day 6. So again, if your student isn't returning because they haven't met the criteria to return, please just give your school a call and let them know your student will be absent. And of course, your student should be masking the full 10-day period whenever they're around people, whether at home or at school. Beginning on August 15th, there will be 2 ways you can report your student positive for COVID-19. The first is to fill out a Google form. It's called the BUSD Student COVID Case Reporting Form. In that form, we asked you key questions that help us understand if your student was on campus while infectious and if we need to do any contact tracing relative to their case. We ask you some things about your student's school day, and we really appreciate your thoroughness in filling this form out. The information is very helpful and allows us to move quickly. So this would be things like if your student participated in a before or after school program, or played on a sports team, or was involved in any extracurricular activities, or rode the bus to school, or even carpooled with other BUSD students. A second way to report your student positive is, again, to send that email to covidcase@berkeley.net with all of that pertinent information: student's first and last name, school, date symptoms started if they had symptoms, date they took the positive test, and their last day at school. You can also add other important information relative to sports and extracurriculars and transportation to and from school. It's all helpful for us to have. Finally, I just want to talk about how to upload your test results to the primary health platform and why it matters. If we get our families to participate strongly in uploading test results, both positive and negative, we get real-time information about how COVID is moving through our school community. This information is also shared with our public health partners, and it allows them to very quickly provide us with timely information about how we should be responding to cases. Now, if your student participated in testing last year at BUSD, they're already registered in primary health, you'll need to update your registration, and that only takes a minute. You should be receiving some notifications from primary health asking you to do that. If you go to our safety plan on the BUSD website, there's also a link to update your registration. If you're new to the district, or if your student did not participate in our testing program last year, it's very easy to create a primary health profile for your student. It takes just a few minutes. Again, there's links for doing that in our safety plan, and principals will be sharing those periodically with our school community as well. Once your student is registered or you've updated the registration, we'll ask you then to please upload your student's test results. You'll receive periodic notifications from primary health with links that you can click on to upload test results. Those links are also on our safety plan. And in order to upload your test results, you really only need to provide a couple of pieces of information about your student, including their birth date, what kind of test they took, the result of the test, and they also ask you to upload a photo. Thank you again for your participation. We had very strong participation last year, and it was extremely helpful. This brings us to the end of the webinar. I do want to remind you that our safety plan sits on the BUSD website. We update that safety plan periodically, including providing information about upcoming vaccination clinics. There's also a COVID-19 case dashboard that you're probably familiar with. If you're new to the school district, the dashboard is updated every day, and it gives you a snapshot of cases in all of our schools and at our facilities. And the old dashboard from last year and the year prior can also be found, or links to those dashboards can also be found on the current dashboard. Finally, I just want to remind you that the contact tracing team at covidcase@berkeley.net is always standing by to answer your questions. So thank you for listening to all of this information. Please be assured that we are ready, Berkeley ready, to start this school year with all of our risk mitigation protocols in place. And most of all, we cannot wait to see your students back at our schools on August 15th.